Joining us now is Dr. Christopher Labos, cardiologist and epidemiologist, who's joining us now to discuss COVID. Hello, Dr. Labos.
It's not Sunday. What's going on? I'm very confused.
Dr. Labos, you know that I almost said good morning again.
Yeah.
For those of you who don't know, Dr. Labos is a regular on Weekends with Joanne Brackus. But I have you here. I said to Dean, our producer, let's get Dr. Labos on because I'm looking at these numbers.
Yeah.
Quebec Public Health is reporting that basically 1 in 5 COVID tests are positive right now ahead of the fall vaccination campaign. When you hear those numbers, are you concerned, first of all?
It depends what you mean by concern. I think this was to some degree expected. We are seeing the beginnings of the winter uptick that I think most of us knew was coming. I think it is shocking for people who, don't follow this sort of thing the way I do, because not that long ago we were at about a 2% positivity rate. Now we're over 20%. So it's been a big uptick. But this is similar to what we saw last year. By the end of the summer, cases started to going up, driven, partly by all the vacation travel that people were doing, partly by the start of schools. And so there is a lot of COVID circulating, and that is translated into an uptick in cases, an increase in the wastewater data. And then when you tell people, well, how bad is it? And you tell people, well, there's, about 48 deaths per week from COVID. I think a lot of people are taken aback. They're like, what? I thought it was 0.
Let's repeat that, Dr. Labos. 48 deaths in the week of September 15th.
Yeah.
That is a shocking number.
It isn't, because for those of us who have been paying attention, this is unfortunately what we see. But I think a lot of people, because the narrative around COVID has sort of passed a lot of people by, I think a lot of people genuinely believe that there was no COVID circulating. So to find out that, the numbers are, non-trivial, the number of deaths is non-trivial and this is part of the problem, because a lot of people look at it from the perspective of, well, does this affect me? And the truth is that if you're, a young, healthy person with no, underlying medical problems, you probably are going to survive COVID, especially if you've been vaccinated and have had COVID before, right? But just because something doesn't affect you doesn't mean it's not relevant for the population as a whole. And I think that's the subtlety that's hard.
And I want to talk to you about that, Dr. Labos, that narrative. A lot of people just recently got COVID, got over it, and there is a new vaccination campaign coming. We'll talk about that in a second. There is a sense, I already got it. I'm fine for this year. Does that hold true?
No, not really. So the number of doses you've had in the past doesn't really matter, because it is essentially an ever-changing virus. There are new variants that are constantly emerging. And so in the same way that it's a different flu virus every year, it essentially is a different COVID virus every year, and there's multiple variants circulating. So the number of doses you've had in the past doesn't really matter. If you just got COVID now, you will have some degree of immunity for several months, somewhere between 3 and 6 months. So the recommendations are that if you got COVID, there's probably no added value to getting an extra vaccine in the first 3 months, possibly the first 6 months post-infection, because if you were to get a vaccine dose, it wouldn't do anything. Your circulating antibodies are already high because of your prior infection.
So there is a campaign that's forthcoming. The government hasn't set any new dates. We've discussed this in the past, but when you hear 48 deaths, do you feel like there should be a bit more of a sense of urgency here?
I think there should be. And again, it becomes a question of tone and priority, right? And I think, a lot of people have, say some variant of, I'm done with COVID. COVID vaccine, COVID fatigue is setting in.
Mm-hmm.
It is important. It is important. Now, it's always the question of, how do you roll out a vaccine campaign like this? Do you do it broad to try to catch as many people as possible? Do you do it hyper-focused and risk leaving some people behind? There's some interesting conversations to have about how to shape this. Should the COVID vaccine really be tied with the influenza vaccine? Because influenza tends to peak later in the winter, whereas COVID is surging now.
Yeah.
So should we uncouple those two things? Again, it becomes a question of logistics. Do you do what's scientifically more valid, or do you try to give more weight to the practical realities of doing one mass vaccine rollout rather than two? And these are interesting questions, and people can disagree about the best way forward. And I
Yeah.
don't think we know what the
I
best
think I
strategy
think generally people prefer to do the right thing, the thing that makes more sense for your health instead of
Yeah.
what the organization. But let's talk about these vaccines because 3 new vaccines were recently approved by the Canadian government. Can you discuss that if there's any major significance or a difference, I should say, between these vaccines? I remember when they first came out. Remember there was the Moderna, there was the Pfizer, there was the Johnson. Everyone was telling, oh, I got this one. Are there any significant differences between these vaccines?
Yeah, so the Pfizer and the Moderna vaccines are the mRNA vaccines. This is the technology that uses, mRNA, genetic information, which does not alter your DNA, despite what many people say on the internet.
Important to repeat that, Dr. Labos. Important to
Yeah,
repeat
the mRNA vaccines do not change your DNA. That's not how that works. They are very safe. Like, at this point, billions of people have gotten mRNA vaccines. Hundreds of millions, if not billions. So there's no danger to this. I think we've proven that vaccines are safe and effective. There's no major difference between Pfizer and Moderna. There's subtle differences in terms of dosing that they have in the formulations, but for all practical reasons, you can look at the Pfizer and the Moderna vaccines and say that they are basically interchangeable. So whichever one is available near you, you get that one. It should be fine. The third vaccine that's out there is Novavax. And Novavax is not an mRNA vaccine. It is using, quote unquote, older vaccine technology to make a standard vaccine dose. It, however, is not directed against the KP2 variant. So Pfizer and Moderna are directed against KP2. KP2 and KP3 are the variants that are currently circulating.
Oh.
No, Novavax is directed against the JN1 variant, which was circulating a few months back. The downside of the more traditional vaccine technology is that it takes longer to manufacture. And so Novavax has always been a little bit behind the 8 ball in keeping up with the ever-changing
variants, right?
Yeah. And so what I've heard is that the government is probably not going to be ordering large amounts of the Novavax vaccine to roll out. So it is approved. You can, in theory, still go out and get it and buy it, but it may not be part of the government's mass vaccination rollout. They may be focusing entirely on Pfizer and Moderna.
And so let's talk finally about the vulnerable groups that should be getting, I guess, the highest priority on this. Can you run through those, please?
So anybody who has, anybody who's older, anybody who lives in a long-term care institution, anybody who is vulnerable, meaning they have pre-existing medical problems, who is immunocompromised, things like cancer, underlying heart, lung disease, right, those types of things. People who live in remote areas and can't actually access medical care. So you sort of have to think about these are the groups who are going to be at highest risk. Now, I guess I do fall into a high-risk category because I'm seeing patients and, dealing in the medical field. So I intend to get the vaccine, even though I'm not especially worried about myself surviving a COVID infection. But I will still get the vaccine because even though I probably won't die, I don't really want to get sick. I don't really want to get long COVID. And I think we've seen that even though the vaccines are not 100% effective, they do reduce the risk of both of those things rather substantially. So,
and I know this can be an entire different topic, Dr. Labos, but kids, kids bring home everything. As you know, we've discussed famously that kids are disgusting. Your words, not mine. I agree. But they bring home everything. So what's happening with kids in COVID?
So, kids still get COVID, obviously. They are at lower risk than the general population. I do not have children, right? Disclosure. If I did, though, I probably would want them to get the updated vaccine because I don't want them to get sick. Because, it's all well and good to say that children are low risk for disease. It's a much different thing when you're the one that has to take time off work to take care of them when they get sick. And, the difference between your child riding out a mild cold sniffles at home is very different than you having to take your child to the hospital because they're a little bit short of breath and you need oxygen. So there are considerations there. So they are definitely at lower risk. They do not, qualify as the high-risk group that the government has
identified,
highlighted. But, the vaccine is open to everyone, and you can get it even if you are not a high-risk individual.
Dr. Labos, before we let you go, people, they hear you, but they also want to see you. Where can they see you?
Okay, so October the 4th, so this Friday, I'm going to be at the Dorval Library. You can go and register for that. And then on October 20th, I'm going to be at the Hudson Hub in Hudson. So I'm going to be giving a talk there, so you can check those 2 events out.
Go see Dr. Christopher Labos. Buy his book. Get it signed. Thank you so much for taking the time.